So Blake, why don't you tell me why you're here today?
Well, the main reason is because I trust you as a urologist for the last 25 years.
Well, you know, you've been my patient for a long time now.
That's right. And I do it because I trust you.
Well, I appreciate it.
You're a good cat, man. So why
well,
not?
you know, you have to trust someone if you're actually entrusting them with your
With my stuff,
family
yeah.
jewels. Exactly.
Hey, I always go on the street and see somebody. Hey, will you hold this for a second? Arrest my ass, right?
Yeah, that's the thing. I guess I don't get arrested for doing these kind of things.
Lucky you, man. Man, I bet your day is coming, dude. Better be cool. Get some good insurance.
Yeah.
Hey, I know a lawyer over in Florida.
So, we're talking a little bit today about the curvature in your penis. And if you could just maybe give me an idea on this about how much it's curving.
Are you the only one to touch that?
Yeah.
Oh. Just kidding, folks.
Okay, so it's about 30 degrees. And that's pretty typical. And does it curve up?
Yeah.
And that's also pretty typical. 70% of Peyronie's disease actually curves upward.
Well, why is that? Why is it not curved to the side or down?
So, if you look at a cross section of the penis,
Hey, man, I don't like that.
it's not to scale.
Oh, okay.
You have what's called the tunica. Tunica is like a wrap, a covering, and it wraps around the spongy tissue in the penis. And what happens is you might be having intercourse, or even if you're at night and you're asleep and you roll over and the penis bends a little bit, you might wake up and then go back to sleep. But that little injury sometimes can lead to inflammation.
Whoa.
And then lead to deposition of collagen. And that collagen forms right on that tunica.
But
And
only
so-
on the top?
It can form other places, but most commonly on the top.
Yeah.
And so what happens is that tissue is strong, but it doesn't stretch.
Fibrous.
Fibrous, right? So it's mostly collagen with a little bit of elastin. And so you can actually get curves to the left, curves to the right, most commonly curves up, and some people even curve down. And the other really distressing thing to patients is that they have a shortened penis. So their penis can be shortened by a half an inch, 2 inches, sometimes even up to 6 inches.
You should tell them, don't worry, it's not... it's the emotion that makes your baby want to rock. Ain't the size. But anyways.
So this collagen are like long, thin, parallel fibers. And if you look at it under the microscope, this is what it actually looks like. And in the penis, there are two layers. There's the circular layer that gives you girth, and the longitudinal layer that gives you length. But what happens when you have scar tissue is that collagen no longer is organized in a nice way. And so collagen, usually when it stretches, just pulls apart like this, but if you have scar tissue, it's locked down. And so there are a couple things that you can do to fix this problem. One is an FDA-approved enzyme called Xiaflex or collagenase. And what that does is it dissolves the peptide bonds between those collagen fibers. The problem is that you can have a risk of penile fracture long-term.
Or it goes like this. No, it's like a relay stump.
Yeah, sort of
Okay.
like that.
Yeah, just like that,
And
folks.
and so because of that, after an injection, you're not allowed to have any sexual activity for about a month. The other problem is that for the injection itself, just the cost of the medication is $3,000 to $4,000.
Damn.
And most patients need to about 4 to 10 injections.
Just like some kind of special combination of elixir that they had to go to some African place and dig it out, and it's only so much.
Usually the Amazon.
Oh yeah, the Amazon, that's right. They gotta have all the cures, huh?
So what you would actually do is inject it into the plaque. And it disintegrates those peptide bonds.
Excuse me, how good is that disintegration? Is
So that's a great question. It improves it about 15%. which, it's not a lot for the amount of effort. Another option is surgical removal of the plaque with placement of a patch, or you can do what's called plication, which is you do a circumcising incision, pull the skin down, and then make the long side short. So you actually straighten the penis, but you make it a lot shorter. And I've never, in 20 years of being a urologist, I've never actually had a patient come in and say, I'd like to have my penis made shorter, please. So it's not a particularly popular operation. What you really want to do is dissolve this scar tissue and have a healthy, normal penis. And the idea is to convert collagen that looks like this into collagen that looks like that. To basically to pull it out and straighten it so that those fibers slide along each other.
I'm with you on that.
Exactly. And most of my patients who've undergone Gainswave with the penile stretching procedure will get anywhere between a half an inch to an inch and a half of length back on the penis.
That's okay. My wife's complaining already. Just kidding. No, I'm not kidding. Okay.
So what we do is we do Gainswave, but not sort of the way that we typically do it for erectile dysfunction. We use a much more narrow tip to focus the energy into the scar tissue, to break up those peptide bonds using the intense shock waves. And then once we do that, the second part of it is to stretch the tissue. And so the Gainswave shockwave therapy is only a small part of that. The other part is the work that you have to do at home, which is to use the penile stretching device.
Oh, that thing.
Exactly.
I just messed with you, man. You can edit that out, right?
And so this is one of my favorite gifts one of my patients ever got for me. I got this beer opener from Bali.
Nice.
So what you would do is put this over your penis, and then this creates suction. And it pulls the penis up into the device. And the idea is to get a full erection and then pull a little bit more. And what that does is it stretches that collagen, breaks those peptide bonds, and pulls the collagen into a more straight position so the penis can stretch more. And so then you hold it for a minute, and then you hit this red button and release the vacuum. Because you're pulling venous blood into the penis, the erection will go right away. If it was arterial blood, then the erection would stay, but venous blood just goes right back.
Why is that?
Because there's nothing pushing. Arterial blood pushes the blood into the penis.
Okay.
But venous blood just comes back in through passive flow. Then what you do is you inflate the penis again, hold it for 1 minute, and then release it. So do 4 cycles of 1 minute 4 times a day. Okay, doing the stretching without the shock wave will actually make the situation worse. Because when you stretch tissue that hasn't been treated, what you'll end up doing is overstretching the normal tissue,
tearing it,
and not stretching the regular tissue and tearing it. Exactly.
Yowza.
So patients like yourself will need 6, maybe 12 treatments with the shockwave therapy to loosen up that tissue and to use the
That's the more intense focus.
Exactly.
Okay.
Exactly. We also we do the regular Gainswave to improve erectile function, because at night when you get erections, we want that tissue to also stretch.
So I got a question. So you got it down to a minute for repetitions?
Exactly.
So how do you know if you stretch it or any of these things will snap while you're doing that?
Well, this is all microscopic.
Okay.
And you see all these little fibers here? Those are the bonds between the scar tissue. And so what you want to do is break up those little fibers that are connecting the main fibers so that the tissue can stretch along a proper axis.
Will this slough off somehow, be reabsorbed through the...
It gets reabsorbed and made into other stuff.
Okay.
Your body conserves materials.
Body's pretty amazing.
Yeah, it's pretty amazing. So do you understand what
I
we're
got
up
it,
against?
man. I'm ready.
Beautiful. All right. Sounds good, my friend.
Thanks.